Good afternoon. Which bacterium is normally present in a healthy body but is capable of killing us? Enterobacter aerogenes. E. aerogenes is a gram-negative facultative anaerobe that can be found in animals, humans, soil, sewage, and water. A facultative anaerobe is an organism that can survive and grow in the presence or absence of oxygen. E. aerogenes also belongs to a group of bacteria known as the enterics, and they reside in the gastrointestinal tract in humans. The presence of this bacterium as part of our normal microbial flora is beneficial to humans because it produces bacteriocins that kill off potential pathogens. However, this microorganism can become an opportunistic infection that harms the host in specific situations. Opportunistic infections can occur when a person has a compromised immune system, removal of normal flora from the body, or a migration of E. aerogenes from its normal environment. Now that we know E. aerogenes can cause infection in people, we will discuss the virulence factors that enable it to harm us. The following traits allow this bacterium to cause disease in humans. E. aerogenes has flagella and fimbriae, and they increase its ability to cause disease. Flagella allow the bacterium to propel itself away from harmful substances. The fimbriae function in attachment so that the bacteria is able to stay within the body. E. aerogenes contains endotoxin, which can cause fever, damage to blood vessels, inflammation, and shock. This bacterium also contains sex pili, and they can facilitate the horizontal transfer of genetic material between bacteria. Antibiotic resistance genes can be found on plasmids, and they are easily transferred from one bacterium to another via sex pili. Now that we know some characteristics of E. aerogenes, what are the practical uses of this knowledge in the healthcare field? E. aerogenes can grow in several different types of environments, so it can be difficult to prevent infection by this organism. Nosocomial infections are illnesses that are acquired while in the hospital, and this bacterium is a common source of these infections. Patients in the hospital already have a compromised immune system, so this microbe can easily infect sick patients. E. aerogenes has been proven to cause infections of the skin, respiratory system, and urinary tract, along with adult meningitis. Urinary tract infections are the most common type of nosocomial infection, and this microorganism usually enters the body via an indwelling catheter. Contaminated catheters and improper catheter insertion account for most urinary tract infections. 40% of all UTIs that occur in the hospital are caused by E. aerogenes. Patients who undergo a surgical procedure also have a high risk of developing an infection from this organism. A study conducted in 2010 monitored 12 patients who underwent cardiac surgery. Of those 12 people, 15% of them developed infections from E. aerogenes that came from their own gastrointestinal tract. This occurrence is a specific example of normal microbiota becoming an opportunistic pathogen due to relocation within the body. Antibiotic resistance is a growing medical problem because treatment options are limited once resistant strains of bacteria emerge. Within the last 25 years, E. aerogenes has become resistant to numerous classes of antibiotics. This bacterium has shown resistance to beta-lactams, chloramphenicol, first and second generation cephalosporins, and fluoroquinolones. Infections caused by this microbe are hard to treat when antibiotics are not effective, and the sex pili are the major reason that microorganisms are able to develop this antibiotic resistance. There are, however, 3 ways to decrease the spread of infection within the hospital. The easiest and most effective measure is for hospital workers to constantly wash their hands. The next way to decrease infection is to always wear gloves when dealing with a patient. Another good practice is to make sure that all instruments and equipment are sterilized or properly cleaned in the hospital. So remember, E. aerogenes usually has a symbiotic relationship with our body. However, this microbe can cause illness and death if our defenses are weakened. E. aerogenes is responsible for several different types of infections, and antibiotics are becoming increasingly ineffective against them. Bacteria will always be present in our bodies, so we just have to make sure that we stay healthy and keep them in their rightful place.